which on what they're presenting?
I'm gonna say, no, why would we do that?
No, go
Why
ahead.
would we do that? I mean, I can't introduce everybody.
That's the whole purpose. Oh, you were having fun when you just fired that in. No, that's really good. I heard you say that, right? You said this.
No, I know. I said it was unexpected.
No, you said something. You said this is really good. I like that.
Yeah, it was good on your part. It was good on your part.
And this is also good on my part, but when you're sitting there, it's also good for you on your part too. Okay. Now, the reason we are doing this part is because I want to see how you guys are going to deal with the way we are working together. Just taking over.
Our name of our corporation is a Woman's Touch LLC. Dana was the CEO, but as Kemal said, she got demoted. So I'm Jacinda. I was the COO. I am now the CEO. Dana will be the COO. Teresa is the CFO, and Kaylin is the CQO.
Okay, so a little bit of background information about our organization. A Woman's Touch is a Delaware not-for-profit organization. We specialize in the stages of pregnancy, gynecological healthcare, and reproductive medicine. Our primary focus is to provide specialized women's healthcare services all throughout Delaware. Okay, a little bit of background on not-for-profit information, just to give you kind of a basis for where we come from. We operate as if we're a regular old business, but we do not seek a profit. We do not pay taxes, and donations are tax deductible up to certain limits. We must register with the IRS under Section 501C of the tax code. We also provide a great community benefit by providing treatment, promoting health, and healing in response to specific community needs. This is just our organizational structure, just kind of a little brief chart. We have our CDO. Below that we have HR, our COO, our CFO, our CQO, and our CMO. Under our COO and our CFO are our medical assistants, our office staff. Under our CMO we have our physicians, physician's assistants, and nurse practitioners. A little bit more information. We have 4 locations all throughout Delaware: Wilmington, Middletown, Seaford, and Dover. We have 8 physicians, 6 physicians assistants, 11 nurse practitioners, 8 medical assistants, 20 office staff, and we are the 4 owners. A little bit more in-depth detail about everybody who's part of our organization. Our physicians, they examine the patients, they diagnose illnesses, and prescribe and administer treatment for people suffering from injury or disease. Our OBGYNs specialize in women's health. They're responsible for women's general medical health care. They also provide care related to pregnancy, reproductive system, and like general practitioners, they attempt to prevent, diagnose, and treat general health problems, but they focus on ailments specific to females. Our medical assistants perform administrative and clinical tasks to keep the offices of the physicians, pediatricians, and chiropractors and other health practitioners running smoothly. Our office staff, they have responsibilities that often change daily with the needs of a specific job or what we kind of ask them to do. They spend their days filing, keyboarding, entering data at computer terminals, operating photocopiers, fax machines, other office equipment, preparing emails, proofreading documents, answering phones, and delivering messages. Our physician's assistants practice medicine under the supervision of the physicians. They are formally trained and provide diagnostic, therapeutic, and preventative health care services as delegated by the physicians. And our registered nurses record patients' medical histories, symptoms, help perform diagnostic tests, and analyze the results, operate medical machinery, administer treatment and medications, and help with patient flow. Rehabilitation.
Alright, so I'm going to talk about us being quality oriented. 25% of our salary incentive based on quality itself. I don't know, I wish we could change that number now since we know that the cap isn't 30% anymore, because that's what we were told, but we're focused on quality over quantity, and our main goal is to prevent ovarian and breast cancer as well as keep our patients satisfied.
Teresa and I, she's the CFO, we decided to do the budget and the balance sheet together. This is just a screenshot of it. I don't know how to go to the budget.
Go to, Excel, like minimize that, like,
Oh.
go to, Excel next to the final. It's not there.
Just minimize mine. I think yours is underneath. No, not that one. The other one. The one, the minimization underneath that one.
Here we go. This is our budget. The payroll physicians comes out to a little over $2 million, and the total for the employee direct expense is about $6.5 million. For the advertisement and some of the overhead expenses, we had to decide exactly how much we wanted to spend on each expense. We tried to make it so we weren't spending too much or not enough, but just the right amount of money. We had to divide that by the total number that we have here by the 4 buildings that we each decided to have.
The 0% are because that's less than 1%, so that's why it comes out to 0,
Oh, yeah,
but it's not really 0%.
So it's supposed to do it with the formula.
Down here is our overhead expense. Is our overhead building expense. The rent that we had to decide, the buildings that we looked up, some of them gave us the rent, but not most of them, so we had to, I guess how much we wanted to pay for rent. Most of them told us how much the buildings were to own them, but we wanted to rent, so it comes out to, I guess $5,000, but I'm pretty sure it would probably be a little more than that. The repairs and the maintenance is around $22,000 that we decided that we wanted to spend on the buildings.
Now, in the total, your rent expense is only $57.
Yeah, because I think 2 of the buildings that we wanted to rent out were already, I think, foreclosed, so they were cheaper.
So they just give you that for free?
So
Well,
the monthly
Not
payment
really,
for them
2
was
of
like,
them were very, very low.
one of the
and then
monthly
we had,
payments was like
an expense.
$300 or something for one of them. So
A year?
no, monthly.
Yeah.
Where are these offices again?
I would say they were really cheap.
Yeah, we
They
saw
were
one.
super
It
cheap.
was really nice. It was already like
You
like
like
a
houses
medical
and-
office and
yeah.
stuff. It was like
Yeah.
18,000. It was like 300.
Yeah, then the total expense was a little over $5 million. The net income was around almost $4 million. I think when we first started to do the budget, I think it was a little higher than that, but that was because we didn't want to be greedy when since we're the owners, we only were going to make around $75,000 each, but he said that we weren't being greedy enough, so we just upped it to like $500,000. So that's why this is so much lower. It's
Final one.
Go back up top from correspondence. So one of our first challenges was the compensation model in terms of salary. We decided that our professional measures would be 30%, our financials 40%, because even though we're not for profit, we still want to make some money so we can reinvest. Our quality is 25%, and we are quality over quantity. Our professional measures are the 3 listed: the number of patient visits, the work RVUs, which are ways hospitals and physicians calculate compensation for staff by using a formula tied to physician services, and proof procedures. Our financial measures are net income, gross charges, and net collections. And our quality measures are average patient satisfaction. We want to make that as high as possible, as well as breast cancer screenings and HPV screenings to prevent cancer.
Sorry.
Our financials are given the highest percentage because they're the easiest to achieve. Quality is a little harder to achieve. We want to maintain, while financial professional can be easier to maintain. Our quality, our goal is to prevent cancers and detect them at the earliest, whether it be ovarian or breast, and keep our patients satisfied because we want to have them keep coming back and also refer us to other patients. The financial and professional measures are focused on procedures, how many patients we see, the amount of income we receive, along with the net collections in order to earn a profit, but also to maintain a patient satisfaction and a professional understanding environment for our patients. The base salary is 70% of the $265,000, which is $175,000. The incentives are the 30%. And they are split into the 9% for professional, quality is 13.5, and financial is 7.5. Each of them average out to about $30,000. 30% of the physician's salary is based on how well they live up to all these measures.
Well, let's actually downsize. Well, you have some changes, so then now your old CEO is the CEO, that she has more time to do more work.
Okay, so our second challenge was the malpractice with a financial impact. A little definition of malpractice: improper, illegal, or negligent professional activity or treatment, especially by a medical practitioner, lawyer, or public official. Little kind of information for you. America's healthcare system induced deaths are the third leading cause of the death in U.S. after heart disease and cancer, so it's very serious. Okay, so our specific malpractice with financial impact was we got a $2.2 million fine. We only had coverage for $1.0 million. So we needed to come up with $1.2 million. After thinking about it, we went through a couple of suggestions, had a couple ideas, got a couple ideas turned down. Some of the solutions we thought about were possibly terminating one of our physicians. We could also take out a loan from our local bank and see if it would, by any chance, cover some of our fine. We also thought about selling assets, refinancing some of our properties, selling stocks, or other collateral. We all said we had very nice houses and cars and everything, so we would be happy to kind of work that out to better our business. So we did kind of go towards more maybe taking out a small loan from our bank and then maybe refinancing one of our properties, seeing how we could do with that, and then selling some stocks to be able to get the rest of the million that we needed. Okay, third challenge was losing a physician. We had a challenge, we were losing a physician due to maternity leave. Kind of one of those things we can't get around. So unfortunately, we either had to hire a new physician or separate the patients between that physician throughout the physicians we already had. We basically decided to go ahead and split out of our 8 physicians that we had. We now have 7. We're going to go ahead and split those doctors. We have 2 physicians at each location. We're going to go ahead and kind of bump up one of our physicians, give them an increased pay raise, so that way they could be more responsible for the patients that we lost from the other physician. And then this is just a little brief more in detail of what we did. We just go ahead and split those patients up, give that other physician a little bit more responsibility.
The first challenge was the break-even analysis. One of the main challenges with this one was how much money we wanted to pay each employee, because whatever we decided would be how many patients we would need to see in order to make a profit. Another challenge was, like I said before, in the budget, we had to determine how much money we wanted to spend on each of the different expenses. We had to determine how many patients we needed to see in order to make a positive income. With that, we had to add up the total cost of the overhead expenses and then the overhead building expenses. The numbers for those were the 1 million, a little over 1 million for the overhead expenses, and then 82,000 for the overhead building expense. We decided that they needed to be divided by, it was divided by 20,800, which totaled out to be a little over, it would bring our expenses would equal our revenue at a little over 1.3 million. So we decided that the patients would pay about $80, I think, for copay. I think we decided that we decided 80 because, like I said, we wanted to make a decent income to where we could pay all of our physicians, the nursing practitioners, and everybody else.
Now, what do you mean $1,332,000 patients?
Yeah, sorry. That was the patients. Was supposed to be in parentheses. That's how much money the patients would have paid for us to break even. So you divide it by 8.
Would be
Yes.
that needs to be divided.
This was just our roles. Dana, she was downgraded, and I was the CEO.
Demoted,
Yeah, I'm saying she's demoted. Basically, the chief executive officer makes the major decisions. Throughout the group process, she was the CEO, so anything that we had, we went through her, and
Did you think that you deserved to be the CEO?
No, I mean, I think I would have done a good job, but I think she deserved it because, as you know, you already know my situation. I played basketball, and I was gonna miss a couple of classes because of that, and so she would have been here more so than I would have. So I think she would have been able to handle and get a lot more things done. So I think she was a good choice. I was the chief operating officer. Teresa and I, she's the CFO. We worked on the budget together. A lot of the numbers, like I said, we had to Google some of them to determine how much we want to pay our physicians, and a lot of the overhead expenses, like cable and the furniture and everything else that we decided that we had to spend money on. And Kaylin, the chief quality officer, she did a lot too. Even though she got fired in the middle of our presentation, she did a lot with having to do with the quality, obviously, of our business. Obviously, in any business, the quality of what you do is going to affect the patients, and our first thought is the patients first.
Any questions?